rob you of your sight, even take your life. A rare disorder that develops after you have your neck adjusted is impacting people in the prime of their lives. Fox 6's Lynn Stewart has more on how to avoid a chiropractic medical emergency.
The disorder is so rare that it's often misdiagnosed by general practitioners, costing patients valuable time that could cost them their lives.
Time is really of the essence.
A torn vessel wall in the main artery to the brain, a rush to save a life.
If you can get quickly enough, sometimes it can be reversed.
The condition can rob you of your sight, leave you a quadriplegic, or even cause death.
This vessel, as it runs through the neck, can be affected.
Neurosurgeons say about 10% of their cases of torn blood vessels come after otherwise healthy patients have their necks adjusted.
Part of the problem you run into is that often patients go to emergency rooms, they don't know them. The diagnosis is made, oh, it's just a little arthritis in your neck, and then something bad happens.
The elderly, diabetics, smokers, and women on birth control are all at greater risk of having torn vessels. Neurosurgeons say the condition is so dangerous because it's hard to predict who is susceptible. He's had patients in excellent physical condition develop a tear after seeing a chiropractor.
It's only when the patient becomes really symptomatic that they then seek medical care. You know, we're notorious for waiting, and by then, sometimes it's too late. The patient's lost the function of their legs, or they've had a stroke.
There are telltale signs of a tear: numbness of the face, loss of vision, nausea and vomiting, or double vision. It's important to point out that it is extremely rare for a tear to occur and can likely be avoided altogether by seeing a properly trained chiropractor.
Okay, so I'm going to be adjusting your neck, so all I want you to do is just take a deep breath.
Dr. Mike Pritsker says chiropractors are trained to spot people who could be at risk for developing a tear in a vessel and are taught techniques to avoid causing a tear in people who are not.
It's something you should certainly be aware of and be cautious of, but it's not something that should scare anyone away.
He says it's very important for patients to make sure they're seeing a qualified professional for their adjustment.
If you come into your chiropractor's office and the first thing they do is lay you down on the table and start adjusting your neck, you really have to question the chiropractor.
He says the chiropractor should find out important information like your family history and whether you're a smoker or not, and then perform an exam, all before ever doing any adjustments.
When you look at the fact that it's about 1 in a million to 1 in 5 million chances of getting a stroke, chiropractic care is still the most, not only is it very effective, it's also the safest form of treatment for somebody who has a neck problem. That's good. Good for another 3,000 miles.
The blood vessels can also be torn if your neck is hyperextended while having dental work done or having your hair washed at a beauty salon sink. Lynn Stewart, Fox 6 News. Well, they're called the Walmart